If you've ever considered testosterone in any way, be it TRT or even PEDs, then I'm sure you've worried about gyno. And if you haven't, you should, because you don't want to end up looking like this.
My name is Bob.
Well, actually, these days, maybe you do. So let me clarify here. If you meet somebody and you don't introduce yourself with your pronouns, or you believe that you're the gender that's on your birth certificate, well then you as a male probably worry about gyno. Don't cancel me, I'm just trying to get to the target audience. If you want boobs, that's fine. This video's just not for you. But what if I told you you don't have to worry about gyno? And that it's certainly possible to do TRT without ever getting gyno. When it comes to PED level doses, this gets a little bit more complicated, but by the end of this video, you'll know exactly what gyno is and what causes it. It's not just estrogen. And most importantly, how to prevent it or how to get rid of it if you do have it. Both men and women have breast tissue. It's a tissue that sits right over our pec muscle, and it's a mixture of adipose tissue and glandular tissue. Women obviously have much more of this than men, and that's largely driven by hormones. Breast tissue is super sensitive to hormonal influence. Receptors for estrogens, prolactin, progesterone, even IGF-1 have all been found in breast tissue, and all of them have been found to stimulate breast tissue growth. The biggest response seems to come from massive fluctuations or large surges of these hormones. Just about every day I have guys coming to me telling me that they have gyno. 9 times out of 10, they don't have gyno. Most of the time, guys simply have a little bit of extra fat or adipose tissue around their pec or right underneath the nipple and think that that in fact is gyno. But I'm telling you here, it isn't necessarily gyno. Now, if you remember earlier, I said that breast tissue is made up of both adipose tissue and glandular. The glandular tissue is key here. If you don't have a gland forming under there, you likely don't have gyno. I think you might just be fat. So before you go down this road of modifying drugs and added in medications, let's first find out if it isn't just fat. And to do this, obviously, just lose some weight. If you get really lean, you can see all your abs, your pecs have striations, and you still have a little pocket of fat or glandular tissue there, then it might be gyno. If your nipple looks a little bit puffy, and then when you get cold and it puckers up and gets hard and that gyno goes away, that's not gyno, it's just a little bit of extra skin and fat. True gyno is going to be hard, glandular, kind of tender to touch, maybe even painful. I'm hoping by this point in your life you've grabbed and squeezed a boob and you'll know that it's a little bit different than just fat. I mean, imagine grabbing your girl's ass and that's fat, kind of juicy, and then imagine grabbing her boobs, which have kind of a firmer, harder texture. That's glandular tissue. So if you have that to a small extent, like a small pebble right under the nipple, that is gyno. Now if it's just soft or squishy, that's fat. Hopefully this makes a little bit of sense. I remember being in like 5th or 6th grade, all us boys started to have some pimples pop up here and there. We had a little bit of peach fuzz over our balls. We were super stoked and eagerly awaiting glorious puberty. And I'll never forget coming out to the playground one day to one of my friends with his shirt up showing off his nipples. He had a firm little nodule under there. All of us boys were squeezing it. We were so pumped for him because he was going through puberty. Little boys are weird as hell. I don't know. We were pumped on that though. And I definitely remember being super jealous because this same guy had like a mustache in 5th grade, and we heard that he got a little bit of finger action at the theater. Flexing that nipple nodule was like a badge of honor. Most boys do get Most boys do get pubertal gyno to some extent, 60 to 70% to be exact. Saying pubertal gyno fast is super difficult. Say that 5 times. Do it, I dare you. This pubertal gyno is mainly due to large fluctuations of hormones. When you're going through puberty as a male, you're getting large amounts of testosterone production. That testosterone is converted into estrogen via the aromatase enzyme. This is called aromatization. So you have this new large fluctuation of estradiol, and our breast tissue is super sensitive to these fluctuations. I mean, think about your wives or girlfriends right before her period when her boobs are looking super plump and juicy. You go to play with them, give them a squeeze, and you get, ouch, my boobs hurt. It's like a cruel joke by Mother Nature, but this is because her hormones are fluctuating. So what we can take away from puberty and periods and all of that is if we're gonna give ourselves hormones, we should avoid large fluctuations. So whether you're doing TRT or PEDs, avoid a massive surge. Avoid these fluctuations. Ease into it with more frequent, smaller injections. Don't give yourself these massive boluses that spike your hormones and then crash, because that's a fluctuation. Instead, consider smaller daily injections because that's going to lead to stable levels and less symptoms all around. What this means is if you have low testosterone, you likely have low estrogen. And now that you're giving yourself testosterone for the first time, your estrogen will go up. So you should expect at least a little bit of tenderness, just like when you went through puberty or like your girl during her period. Don't freak out, bro. It's normal. Just ride it out for a little bit. It should subside. If the tenderness doesn't go away after like a month or 2 and it's turned into a hard, firm nodule, well, then you're screwed. Just kidding. There's a way to fix it. If it's definitely definitely estrogen driven and you've tried lowering your dose, you've tried more frequent injections, then we should use an agent that's selective for estrogen. We also don't want to just completely obliterate estrogen. Estrogen's super beneficial for neuroprotection, cardio protection, good for our kidneys, good for our libido, good for even strength and hypertrophy. So let's leave estrogen higher throughout the rest of the body to get all those benefits, lower it at the breast tissue where it's causing us issues. So we can look into compounds called SERM, selective estrogen receptor modulator. Modulator in this case means blocker, so selective estrogen receptor blocker. The selective part has to do with what tissue it's going to block the estrogen receptors on. And if you remember, the goal here is to only block the receptors where the estrogen is problematic. In this case, we need to selectively block the estrogen receptors on your titties. And we actually have really good medications for this because of breast cancer. Recently, a large meta-analysis showed that raloxifene had the most selectivity for breast tissue. So that's going to be the agent of choice here. One thing to note here is it's not 100% breast tissue selective. It is the best that we have, but again, it's not perfect. It's going to block receptors in other areas too, like our bones, so it's not something that you want to overuse or just go on willy-nilly. Now, there's other ways to lower estrogen, like aromatase inhibitors, or AI for short. Remember, aromatase is the enzyme that converts testosterone into estrogen. So aromatase inhibitors will block that enzyme so that that conversion can't happen. But remember, I listed off a ton of benefits of estradiol, so you don't want to just completely shut down that production, and that's what AIs will do. So instead of completely blocking that testosterone to estrogen conversion, I personally would only run testosterone up into a point where the estrogen conversion it was producing was becoming problematic. Meaning if you start getting estrogenic side effects, your testosterone level is probably too high. Back it down a little bit and fill in those androgens with other compounds that don't aromatize, like nandrolones or DHT derivatives. And if you're having too much aromatization on even low levels of testosterone, well then maybe you're not dosing frequently enough, maybe your liver is damaged, or maybe you're just too fat, because fat does produce a lot of excess aromatase enzyme, so that's one thing to consider too. Yeah, you might just be a fat ass. Now that covers how to deal with gyno from an estrogenic standpoint, but like I said earlier, a lot of different hormones can be involved here. Let's talk about some of those. I'll never forget my first cycle of Tren because I was super scared to start it. You see, we actually had brain cells back then and we knew it was a super dangerous compound. I wasn't some 135-pound kid with broccoli top and dangle earrings who was gonna do a Tren only cycle for TikTok views. A few weeks in, I was getting used to it. I was actually kind of liking it, other than not sleeping at all at night and ruining my mattress because I was sweating so damn much. I was feeling confident as F and looking hard as hell too. I didn't have a broccoli top haircut or dangle earrings for that matter, but that doesn't mean that I wasn't a douche. So the time that I'm thinking of specifically, I was in Target and I was wearing a cutoff tank in public. You know, the kind that kind of show off your nips. A lot like this, you know, because I guess I thought I was cool. You know, I was a lot bigger, a lot jackeder, a lot tanner, but nonetheless, still a douche. And I remember my nipple itch, so I was mindlessly scratching while looking at something on the shelf. And then I felt some wetness. I looked down and there's some black shit on my fingers. What the hell is this? I remember squeezing my nipple and more came out. It's like all over my fingers, so now I'm freaking panicking. I'm getting the hell out of there. I just left my Target cart right there and I'm booking it straight to the car. I thought either A, I had cancer and was definitely gonna die, or B, Satan's demons possessed me because now I'm bleeding black. So I did what any young, reasonable bodybuilder at the time did, and I hit the forearms. And I was actually really pleasantly surprised to find out that I wasn't the only person whose nipples were bleeding black. I say bleeding because bleeding sounds a little bit more masculine and less embarrassing than milk coming out of my nipple, but yeah, it was actually kind of like black milk, essentially. Steroid game is not a game for the faint of heart. But anyways, thanks to the forums, it turns out a lot of guys were experiencing this from using Tren. But this is weird because Tren doesn't aromatize into estrogen, so what is causing this? The thought then was that Tren elevated levels of prolactin, but we've never actually really seen this in the data. Another explanation could be that it's the testosterone that you have in with the Tren that's aromatizing into estradiol, and the estradiol is having a stimulatory effect on the latotropes of the pituitary, leading to excess production of prolactin. And prolactin's main role, especially in females, is to increase breast tissue growth and produce milk. And if high enough, it can cause that in men too. Another consideration could be that Tren has a high affinity for progesterone receptors, and there's a lot of progesterone receptors in the breast tissue, and that might stimulate the growth and the weird black milk production. We're not sure. Yeah, that's part of the problem with running compounds not made for human use. You just don't even know what the hell's going on when something goes wrong. Now again, let's just go through our checklist. First, you want to stop all those fluctuations, so if you're not microdosing already, start doing that, and then consider maybe lowering the testosterone dose to lower the amount of aromatization. But if you've tried all that and it hasn't worked and you get labs and you know for sure the issue is prolactin, well then we can consider lowering the prolactin. The first thing I like to do to try to lower that is to add some B6 into the equation, specifically the active form, which is called P5P, 50 to 100 milligrams of that at night, because it can help to improve your sleep quality, and if you're on trend, you're gonna need that. Now, if that doesn't work, then we might need to use some dopamine agonists like cabergoline or pramine. But these drugs come with a hefty list of side effects. They can actually be pretty dangerous. Like caber can have some pretty detrimental effects on your heart, so please don't just go adding these in willy-nilly. I use that term willy-nilly a lot. Where the hell did I even get that? It's like from my grandma. I like it though. Don't do shit willy-nilly. It means like, don't do things without giving it a little bit of thought. So thus far we've talked about the causes of gyno being either estrogen, prolactin, or progesterone, but there's also IGF-1 receptors in breast tissue, and that may stimulate breast tissue growth as well. So if you're on a cycle and everything's going right, and then you add in GH or a GHRP and suddenly you start developing gyno, well then maybe that is the culprit. Now, since there isn't any selective IGF-1 receptor modulators for titty tissue that I know of, I would just recommend stopping the GH at this point. And this example speaks to the importance of slowly adding in compounds. If you were just to start everything all at once, you've got test, D-ball, tren, and growth hormone, for example, and you get gyno, well, what the hell's causing it? Could be any of those things. So it's super important to slowly add compounds in. I would start with one thing and run it for 2 to 3 weeks to see how it feels before adding another thing in. Now, when you become a veteran and you know how all of these things work in your body, of course, you can just jump straight to the cycles that work well with you. But in the beginning, take it slow, dude. Ride it out. See how things feel. On top of estrogen, prolactin, progesterone, IGF-1, there's also one more hormone receptor that I think we should at least bring up, which is HCG, human chorionic gonadotropin receptors. Now, this isn't fully well known and demonstrated in the literature, but there is some thought that there are HCG receptors in breast tissue, which would explain why some guys on TRT who are running HCG concurrently to preserve fertility run into issues with gyno. Same thing with guys who go on HCG for a post-cycle therapy and suddenly they have gyno. Their whole cycle, they were fine, they were looking jacked, they were doing great on high levels of androgens, and in their PCT, they're getting gyno. What the f? Now, it doesn't really surprise me that a female pregnancy hormone would have this effect in men, but again, to my knowledge, there's no way of selectively blocking these receptors, and you probably wouldn't want to do that anyway, so just pull out the agent here again. Now, on top of hormones, there's also other causes to gynecomastia that don't often get addressed, but I think are super important. It's obvious that fat guys probably get gyno a lot more than lean guys do due to their increased aromatase expression from all the adipose tissue, like we alluded to previously. But what happens when lean guys also get gyno when they're not on robust levels of drugs? What might be going on then? Well, some data suggests that insulin resistance may actually exacerbate the production of gynecomastia. When you have insulin resistance, your pancreas is producing more insulin than it otherwise would because your tissues are resistant to it, so it's trying to just increase that signal by producing more of it. And interestingly, insulin seems to increase the expression of aromatase in breast tissue specifically. Higher levels of aromatase enzyme in breast tissue leads to higher levels of estrogen in breast tissue, which leads to higher agonism of estrogen receptors in breast tissue, and then you've got gyno. So might not be hormones, bro. It may just be a sign of poor metabolic health. And to add to that, there's even some data that say that leptin resistance, which again is a marker of poor metabolic health, may also contribute to gynecomastia. So as you can see, there's a lot to think about when you're dealing with gyno. But gyno isn't the only possible side effect that you may deal with if you hop on testosterone or other PEDs, and if you want to learn how to combat other testosterone-related issues, click this video here.